Just a thought on twisting the numbers. Let's just go back just a few days ago, March 25th, 7 days ago. 13 deaths in a day, an apocalyptic coronavirus surge at a New York City hospital. Well, for those of you that don't know, over 420 people die every single day in New York City. A death is recorded on average every 9 minutes. So 13 deaths a day is not an apocalyptic coronavirus surge at all. It's not a surge in deaths. It's not a surge in any facts. Less than a 1% increase is not an increase at all. In fact, there's no way to tell that these 13 deaths are even specifically related to COVID-19. We don't even have enough testing to know if it's anyway. Now, I followed New York City death care workers as they collected the bodies of people killed by the coronavirus. Look at this salacious headline. And I saw a growing, chaotic, and risky battle. Yeah. Well, you show a picture like this, and you could scare the out of anyone. Trust me. But the numbers don't lie. This is coming from my partner in an email 3 hours ago. Currently hospitalized in New York State, 12,000, up from 10,929, which is a pretty normal number for hospitalized. Intensive care, 3,022, up from 2,710, which is a high number, but typical of other high-risk times. It's not unmanageable, just unmanageable now because they've reduced their stockpiles in recent years for no purpose. But New York City is also seeing 1 in 5 under the age of 44 hospitalized. But they're not dying. That's just to scare you. Now let's get to some more facts. Yeah, many New York coronavirus patients are young. And it's not surprising because millions of young people have the disease and they're asymptomatic. But just a few are moseying their way into the hospitals. And as the total confirmed is based purely on testing, not on the spread of a disease, the numbers are fake. The number of deaths for leading causes of death in the U.S. are in the millions. Heart disease, cancer, accidents, chronic respiratory diseases, over 160,000 annually in the U.S. Stroke, almost 150,000. Alzheimer's, 120,000. Diabetes, if you add all this up, we're in the millions annually. And how you can blend a few 10,000 of deaths into these numbers is quite easy. Easy peasy. When you claim 13 deaths in a day is an apocalyptic coronavirus surge, you're a liar. Anything less than 13,000 deaths in a day in New York City is not apocalyptic. So you're a factor of 10,000 below apocalyptic. And yet 7 days ago, they claimed that 13 deaths in a day was apocalyptic. So 130 deaths in a day is still not apocalyptic. 420 deaths a day is normal. How are they padding the numbers? There is no way to confirm who's dying of what ever in any of these cities. It's all conjecture. And for the people that followed the death care workers and took this picture, they should be ashamed of themselves. This is part of the natural process. If you don't think pandemic and disease is part of healthcare, then why did you get involved? The numbers are being used for a purpose, and it's not to keep you safe. Well, partially it is. But the other part, well, we're watching and we're waiting. Because based on the lies, something else is afoot. You can either stick it in your mouth or stick it up your, but they're certainly sticking it somewhere.